So you've just dislocated the shoulder joint, or you've just had surgery following a dislocation. You're in a sling, you don't really want to touch the shoulder, and you're not sure where to get started with exercises. So within this video, I'm going to break down the best exercises that you can do to restore the range of motion of the shoulder, to stop it becoming stiff later down the line, and also to start strengthening the deep rotator cuff muscles that surround the shoulder joint in order to reduce the pain, but also to kickstart the strength within the joint. By the end of these 2 weeks, you should have 90 degrees of flexion, 90 degrees of abduction, and a little bit of external rotation. With this exercise, you want to grab a chair and allow the other shoulder to dangle freely. You'll feel that this will start to create some space in the shoulder, and it will feel really nice to let it go. From here, you want to draw 8 to 10 circles in one direction and 8 to 10 in the other. Repeat this through 2 to 3 times a day. The pendulum exercise is a really nice gentle stretch. It just allows you to start restoring the range of motion with the joint really early on, and it shouldn't be sore. Make sure you don't push this one when you're doing it. To perform this exercise, you want to grab a stick and then lie on your back. From here, with nice straight arms, you just want to gradually and slowly lift the arms up above you. You really want to use your good shoulder to do the majority of the work, so you don't stress and overload your bad shoulder. From here, you want to repeat through 8 to 10 times. Remember to breathe and go through nice and slowly, so you can gradually stretch and gain that range of motion right at the top. To adapt this exercise, you want to grab the end of the pole with your thumb. From here, you can use your good shoulder to push you up to 90 degrees of abduction, and then very slowly bring yourself back down. You want to repeat this through 8 to 10 times in a nice and fluid motion so as to not stress your shoulder. The next range you want to work into is external rotation. So plant your elbow really nice and firmly against your side and just slowly rotate the arm out and just start to breathe at the end. This is a really great test to see how restricted the shoulder is and how much range you've got. Don't be worried if you can't get the range at this stage. It's quite challenging, and only go with what feels comfortable. Active assisted essentially means that you're assisting the action. This stops the rotator cuff muscles, or the muscles of the shoulder, from overworking, just to allow the structure that's been repaired to heal and fully settle. So this is an easy but surprisingly challenging exercise. So you want to place your elbow against your side and just push out with your palm. From here, you want to contract for roughly 10 seconds. You should start to feel a little bit of activation around the back of the shoulder. If there's any pain, then just ease off with the pressure that you're applying. You can do the same into internal rotation, so just place a little bit of pressure against the palm, and from here you should feel it inside of the armpit. Just hold nice and gently for 10 seconds. You can then alternate between the two, so pressure on the outside, pressure on the inside, and just repeat through relatively frequently throughout your day. There's no set number to do here. Strengthening the muscles in this way is a really great way to mitigate symptoms of pain, but also the activation really helps to kickstart the strengthening exercises that are later on down the line. So I'm just demonstrating the movement. You want to come down and pull up as if you're pulling a chainsaw or a lawnmower. What this does is really starts to engage your scapular or your shoulder blade muscles as you pull it down along the rib cage. You want to rotate forward and then just really pull yourself back, just getting a really nice squeeze around the bottom corner of the shoulder blade. Scapular clocks are essentially designed to work all of the muscles around the shoulder blade. You want to squeeze the shoulder blade down to work the lower traps, you want to lift up to work the upper traps, and you want to pull back to really start to work the rhomboids. Repeat through 8 to 10 times and you should really feel the shoulder muscle starting to fatigue.